A stroke is caused by the sudden interruption of blood flow to the brain, either because something plugs up the artery in the brain or because the blood vessel bursts, causing bleeding into the brain. The result is the brain starts to die, and this causes various symptoms, and those symptoms happen very suddenly. The symptoms of stroke are the sudden onset of numbness, tingling, or weakness, especially on one side of the body, the sudden loss of vision, especially on one side, or the sudden onset of inability to speak or garbled speech or inability to understand what other people are saying. It's very important to act quickly when a stroke happens. Time is brain. We lose millions of brain cells every minute when a stroke starts. And the sooner we can get the blood flow restored, the greater the chance that the person will have a really good outcome. It's pretty easy to tell if somebody is having a stroke. A quick way to determine this is using the FAST examination. FAST stands for face, arm, speech, and time is brain. So the way you do the examination is you ask the person to smile and see if their face looks crooked. You ask them to hold their arms up in the air, like this, and if they're unable to raise an arm or if the arm slowly drifts back down, that's abnormal. And then you ask them to repeat a simple phrase, like "the wind is wild in Wyoming." If any one of those things is abnormal, there's a really good chance that person is having a stroke, and time is brain. So F.A.A.N. If somebody's having a stroke, call 911. There have been some amazing breakthroughs in stroke care over the last couple of years. We're now able to treat people much longer after the symptoms begin. In many cases, we can give clot-busting medication up to 4.5 hours after the symptoms start. Even more amazingly, very recently we've learned that if we can get a catheter into the brain, we can pull that clot out and still save that person's brain up to 24 hours after the symptoms start. So the stroke program at Wyoming Medical Center has been recognized by the Joint Commission as a primary stroke center, and this is a certification that we've held for the past 8 years. And we are also recognized nationally by the American Stroke Association as one of the best centers for stroke care in the country. We're particularly proud of having achieved the highest level of recognition from American Heart Association, American Stroke Association, for how quickly we're able to treat patients. When somebody comes to our emergency room having a stroke, we, on average, get them treated within 30 minutes of arrival. And this is really as good a stroke care as you'll find at any hospital in the country.